So the importance of kind of like dealing with our mental health and well-being through the pandemic and after, you know, the COVID pandemic is going to be the sheer amount of death that we're seeing at the moment is more than we have ever seen. And having to deal with that, where we are going in now and supporting families and, you know, and our patients and their loved ones, a lot's put on us at the moment. We're having to take that, you know, answer all of their questions and having to do that just like this last 3 days where we've lost 6 patients in 3 days. We are having, so if you imagine the conversations we're having to have that those 6 families and the impact that it has on our mental health, and taking that burden and that responsibility to make sure that we're answering all the questions properly, that we're giving them the correct advice and support that they require at that time. You do come away and you do think, have I said the right thing? Have I supported them properly? And you can't help but question yourself and what you have done for them, and that you do take that home, and you do sit at home with your cup of tea after your shift and think, crikey, like, have I done everything I possibly can for that person? So you do take it home and you do think about it, and it does play in your mind. And we're very fortunate that us as a team here in St Luke's, we are very close, we're very supportive, we look after one another, we debrief, we have that opportunity to be able to sit down together and discuss what's happened, because some of our deaths aren't pleasant and it's not a very nice experience, and you're trying to come to terms with that and understand that, and again make sure we've done everything we can. So we are fortunate that we can get that off our chest, express ourselves, be able to kind of have those open conversations with one another, and then it just takes that little bit of pressure off of you. St Luke's, so they do offer support. We have like clinical supervisions, we have health and wellbeing questionnaires that we can fill out, and then our like senior management look at those, and if they see something and it flags up, they can then call us in and have conversations with us on a one-to-one basis and discuss kind of how we are and how we're feeling. We have a St Luke's Stories where it's like an open, I don't know, like a seminar sort of thing where we can kind of discuss openly with different kind of clinical teams within our service. And again, kind of with the Hospice UK helpline, we have that to access as well if we kind of feel like we need that little bit of extra support. So the impact that mental health and wellbeing support has for us as a hospice, probably I will speak for hospices nationwide, is that if we are well supported and, you know, get the right support, we're then able to reflect that onto our patients and their families. So if we are able to express how we're feeling and have the support in dealing with, you know, the certain ways that we do feel, we can then go into our patients feeling happy, feeling upbeat, because we're supported in the background. So then that reflects on them, so they always have a nice happy smiley face under our masks, and they can see it through our eyes. We always tell our patients and their families that we're smiling under our masks, and it lightens the mood. We joke and we laugh with them. We don't go in all doom and gloom. It's about being as upbeat as possible, making this awful experience as pleasant as it can be with the families and the patient. You know, we're always having a laugh with them. We're always, you know, it's not very often we have tears. It's more laughter than it is tears, and that's really important. And I think having that support in the background reflects that definitely with, you know, going forward, looking after our patients. And it's just, yeah, it's just a wonderful job. People may not understand that, but it really is truly a wonderful job, and I'm honoured to be able to do it.